When severe pain hits, waiting days or weeks for relief is unacceptable. Pain is not a symptom you sit with. It is an active biological signal, and it needs precise evaluation, not a cue. When pain becomes overwhelming, most people go to a hospital emergency department. I understand why, but the federal data shows why it so often ends in frustration. Under the Medicare Quality Reporting Behind Hospital Compare, the median Missouri patient spends 154 minutes in an emergency department. At high-volume emergency departments, that rises to 210 minutes. Across the busiest emergency departments in the St. Louis region, the average is close to 4 hours. The longest in this state is 336 minutes, over 5.5 hours for a single visit. That is not incompetence. Emergency departments triage by threat to life, exactly as they should, which means pain that is not immediately life-threatening, waits behind cardiac arrest, stroke, and trauma, and waits again every time an ambulance arrives. And it shows. At the region's busiest emergency departments, as many as 7% of patients leave before ever being seen. The national average is 2%. Nobody walks out after 4 hours because their pain got better. There is a second problem, and it is bigger than the wait. An emergency department is built to stabilize you, rule out the catastrophe, treat the acute threat, discharge. It is not built to diagnose a complex neuromuscular condition. That takes image guidance, diagnostic blocks, and time. The research on how pain is even measured in that setting is blunt. In a study of 539 emergency patients, nurses underestimated patient-reported pain by an average of 2.4 points on a 0 to 10 scale dice, and what they documented matched the patient's own report only 27% of the time. So let me be direct about when you should go to the emergency room. Chest pain, stroke symptoms, new loss of bladder or bowel control, numbness in the groin, or rapidly worsening leg weakness, fever with severe spine pain, pain after a serious fall or collision. Those need emergency imaging and stabilization. Call 911. We are a pain practice, not an emergency room. For everything else, severe pain that is not an emergency but cannot wait, we hold same-day appointments open, Monday through Friday, at our Woodson Road office next to the St. Louis airport. You see a physician, you get examined, and we work out what is actually generating the pain. Text us at 314-886-5902 or call 314-481-5000. Do not spend 5 hours in a waiting room. If something in this changed how you understand your own pain, that was the point. Bring us your imaging, your history, and your questions. Padda Institute Center for Interventional Pain Management. We are at 4477 Woodson Road, Suite 100 in St. Louis, Missouri, right next to St. Louis Lambert International Airport, and at 12174 Natural Bridge Road in Bridgeton. We serve the St. Louis region, Missouri, and Illinois. Call 314-481-5000 or text 314-886-5902, Monday through Friday, 8 in the morning to 5 in the afternoon. Everything in this video is education, not medical advice. Ask for the diagnosis before you accept the procedure.